Hi, my name is Renè Allie, student number ALL80097. This is Part B discussion and reflection on Role Play 2 for my client Stephen. Okay. So question 1 is explain your rationale for using specific solution-focused techniques and cognitive restructuring at the point that you did in the session. So Stephen's cognitive distortion is that he continuously disqualifies the positive aspects of his achievements and successes in his life. My client has pushed himself so hard over the years professionally that he has forgotten how to enjoy his life. Stephen focuses on what other people think of him if he was to retire, rather than focusing on the fact that he works hard and deserves a break. Now, although Stephen acknowledges why his wife would like to spend more time with him, however, his mind keeps going back to these negative, distorted thoughts of loss of social standing and views himself as nothing, and in turn, the community looking at him in a negative way. I took all of this into account when applying techniques. I used encourages with Stephen to allow him to continue with his story and to feel more inclined to open up to me. I also used open, effective questioning to allow flexibility within our session. I wanted to draw out Stephen's story as much as possible by asking him about his profession, which he takes great pride in, and asking him about how he views his retirement in a positive way, focusing on the future rather than the past negative emotions. Once I drew out Stephen's story, I asked him my chosen exception question, as I wanted to see how he overcame his anxiety and negative thoughts when he thought about the troubling situation. It also enabled me to see if Stephen was open to change and if he was being receptive to allowing flexibility in his thoughts. I then moved on to a scaling question with Stephen to see how ready he was to change and if retiring was really something that he wanted in his life, or was he feeling pressured to do so. I then moved on to asking my client a few coping questions to see how he has coped with the triggers and stresses and his troubling thoughts thus far, and to see if these techniques were ones that he could use in the future. Stephen's miracle question was based on seeing himself in the feared situation in a more positive way, without any worries or problems affecting the vision. Stephen was able to imagine how lovely spending time with his wife would be and how much he could relax if he were to retire. I then moved on to using restructuring questions with Stephen. This was to reconstruct his negative thoughts into more realistic ones, breaking away the distortion of feeling like he had failed, and that society would view him in a negative way. The reason I chose to use the stop imagery was to show Stephen how to stop negative automatic thoughts in real time and focus on more realistic ones. This is a technique that he would be able to use on his own outside of our sessions together. I then focused on encouraging my client by complimenting him based on the facts of his achievements. I then also refocused the session on the fact that Stephen was giving too much credibility for his choices to outside forces and not really focusing on what he would like and what would make him happy. I wanted Stephen to look at his future as an upcoming fresh experience. Question 2. Evaluate your effectiveness in implementing and integrating solution-focused therapy and cognitive behavioral therapy approach in each of your chosen techniques. I believe my approach worked for my client to a degree. He was able to see his distorted cognitions. Focusing on the future and what he would like was key to my session, and I believe we achieved that. However, in saying that, there were moments where I feel like my performance lacks stability. I feel that my nerves get in the way of showing my true potential as a counsellor. I've noticed this in both of my sessions for this practical, so I have taken up a few self-help classes to work on this, and I don't want it affecting my work in the future. I feel as though my client viewing me as the professional should be taken seriously, and I feel I lacked in this area due to my confidence levels. I believe my client is open to change, and based on his cooperation during our session, I believe in time he will be able to make his desired decision with no regrets. I find the miracle question quite unrealistic, personally. It makes room for make-believe and sometimes can be misconstrued to clients as false hope. I know that this technique is to allow clients to see changing negative thoughts into positive ones and can make for a much happier future. However, this technique almost acts as a teaser. I wouldn't feel comfortable using this with my clients in the future as there are many factors to consider. My client's mental state, their willingness to change, and the length of time that my client has been dealing with a particular situation. Question 3. Reflect upon the application and limitations of applying an integrated, solution-focused, cognitive behavioral therapy approach to address your client's needs, issues, and goals. I'm going to say that I believe I did well when I integrated the two therapies together. I allowed Stephen to see how he is able to retrain his thoughts and alter his behavior in order to make changes to how he feels. These are strategies that Stephen can use in everyday living. I also allowed Stephen to focus on his strengths rather than what he perceives as his upcoming failures. I also showed Stephen that even the worst possible scenario, if it was to occur, then it would be acceptable, and he wouldn't be able to move on from, and that he would be able to move on from this. I would like to implement using the technique of refocusing on my client in the future using solution-focused therapies, as I really enjoy this therapy style. Rather than my client focusing on the problem at hand, return to focusing on themselves and possible solutions. For example, if I were to have another session with Stephen in response to his "I will be nothing if I were to retire, just another retired old codger," I would ask, how can you make things better for yourself? Bringing back the attention to Stephen. Thank you for listening.